Thank you so much, Elise, and thank you so much to the Global Breastfeeding Collective for hosting us. I will share my screen now and move into our part of the presentation. So welcome to 2 more reasons to step up. I'm Jodine Chase, the Infant Feeding and Emergencies Core Group Facilitator. First, we have a presentation from the MAMI Global Network, represented today by the Emergency Nutrition Network's Nikki Connell. And then after, I'll be coming back to present a new report being launched today. So please post your questions in the Q&A as you think of them. We have a couple of volunteers today who will answer some of the questions directly, and some will be answered by me and Nikki during a short Q&A at the end of our presentation. Go ahead, Nikki.
Thanks, Jane. Hello, everyone. My name is Nikki Connell, and I'm a Senior Technical Associate with the Emergency Nutrition Network. We're delighted to join your webinar today and see how we can join forces to enhance breastfeeding support and continuity of care for small and nutritionally at-risk infants under 6 months of age and their mothers, what we refer to as MAMI. We will introduce the MAMI Care Pathway Package and how it can help put step 10 of the 10 steps to successful breastfeeding into practice. As a reminder, step 10 is coordinate discharge so that parents and their infants have timely access to ongoing support and care. Next slide, please. So what is the problem we are facing? MAMI refers to the management of small and nutritionally at-risk infants under 6 months and their mothers. Small and nutritionally at risk includes infants that are born too early or too small, babies that may be born wasted, underweight or stunted, and those that become malnourished or falter in growth after birth. Millions of infants are affected in the world, as shown by the figures on the slide, and this is a problem across both humanitarian and development settings. Overall, globally, 1 in 5 infants under 6 months is small or nutritionally at risk. These infants are at higher risk of illness, death, poor development, and long-term ill health than their healthy counterparts. For example, an infant with severe underweight in the first 6 months of life is nearly 5 times more likely to die than a healthy infant. Next slide, please. Nutrition for Growth commitments, which outline country commitments to tackling malnutrition in all its forms, have recognised the need to target services to small and nutritionally at-risk infants and their mothers if the required progress is to be made. For example, Ireland has committed to take a leadership role on the issue of wasting globally, and in particular, programming targeted at small and nutritionally at-risk infants. So the political leadership is there to address this issue, but we all need to support progress in practice. Next slide, please. Step 10 of the 10 steps to successful breastfeeding translates to coordinating discharge so that parents and their infants have timely access to ongoing support and care. At present, we see a gap in practice for vulnerable infants and mothers, particularly from when an infant is aged 6 weeks to 6 months. We see poor continuity of care for at-risk infants beyond the immediate postnatal period. Proactive screening for problems is not common. For mothers and infants that do present to health services with clinical or feeding problems, specialised support for breastfeeding up to 6 months of age is often lacking. And we have an over-reliance on inpatient care, with community-based outpatient services rarely available. Breastfeeding is critical to the survival, growth, and development of children worldwide. It is especially so for those young infants who are the furthest left behind. We're here today to see how we can work together to close the care gap and improve access to breastfeeding support for these infants using the MAMI Care Pathway Package. Next slide, please. The MAMI Care Pathway Package is a piece of implementation guidance that comprises a care pathway framework, user guides, and health worker support materials, including forms, counselling cards, and a support actions booklet. to assist practitioners to identify, assess and manage small and nutritionally at-risk infants under 6 months of age. The MAMI Care Pathway Package applies an integrated care pathway approach with a view to achieve continuity of respectful quality care for infants and their mothers across health and nutrition services. It was developed by the MAMI Global Network, led by the Emergency Nutrition Network and the London School of Hygiene and Tropical Medicine, to help put WHO recommendations for community-based care into practice. Next slide, please. Skilled breastfeeding support is central to the MAMI Care Pathway as part of a broader package of clinical care and social support. MAMI covers both maternal and infant health and nutrition, as well as referring pairs on to relevant social and child development services available. Next slide. MAMI links prevention and treatment, but how does MAMI fit in with the breastfeeding services you are already providing through IOICF programming? MAMI dovetails with IOICF interventions that operate more at the primary prevention level. MAMI focuses on secondary prevention, early detection of problems with timely intervention to prevent further deterioration, and also tertiary prevention, which is urgent action to prevent serious consequences of problems should primary and secondary prevention fail. IOICF and MAMI are both essential and complementary initiatives for infants and their mothers. Next slide, please. Now, this is a busy slide, so don't worry about reading every detail. The MAMI Care Pathway applies, builds on, and connects existing nutrition and health services across primary, secondary, and tertiary care. Care is focused at the community level where there is the greatest gap. Screening can happen from pregnancy right through to when the infant is 6 months of age at a range of health contact points. For example, the infant's first vaccination at 6 weeks, and moderate risk infants and their mothers who are identified and enrolled in community-based care receive individualised support and counselling for specific feeding and clinical problems. Those that are at high risk are referred to inpatient care until they are considered moderate and can be referred into outpatient care. All infants are enrolled for support to 6 months of age. Next slide, please. So how is the breastfeeding support provided to these infant mother pairs different and complementary to what might be provided in community breastfeeding support programs? First, this is a package of care that targets skilled breastfeeding support to at-risk infants under 6 months and their mothers, rather than to the general population of infants. The needs of these infants may be more complex and the implications of not getting it right even greater. Secondly, skilled breastfeeding counselling is embedded in a larger package of clinical and social care. This may involve referrals to clinical services, maternal mental health services, and other context-specific support that the pair may benefit from. Thirdly, infants and mothers receive specific, regular and continuous support up to 6 months of age and are not discharged from services until that age is reached. And lastly, as the mother-infant pair are being seen regularly, at-risk infants and mothers remain on the radar of the health service, so they are primed for early intervention and referral for specialist care if required. Here is an example of how step 10 might look in practice. In Rwanda, a successful focus on supporting preterm and low birth weight survival provided a new challenge. 1 to 3 years post-discharge from a neonatal intensive care unit, infants were found to have higher rates of feeding difficulties, as well as anemia, underweight, wasting, and stunting. The services required to address the nutritional challenges were not available in the community. The Ministry of Health, UNICEF, and Partners in Health collaborated to set up 8 clinics to provide focused medical and nutritional follow-up post-discharge. The nutritional component involved training nurses to provide comprehensive feeding counselling and support. This was based on the MAMI Care Pathway Package. A simple algorithm was developed to guide nurses on how to identify, assess, and support feeding challenges alongside other medical support. By moving this support out of the hospital and into the community, it could be provided on a regular basis with follow-up. You can read more in ENN's publication Field Exchange at the link provided on the chat and the slide. Next slide. So now we know that putting step 10 into practice is critical to realising continuity of care between health and nutrition services for at-risk infants and their mothers. Early identification of at-risk infants under 6 months is an essential action to prevent further decline in the nutrition status of an infant, and the MAMI Care Pathway can support this. It is also clear that skilled breastfeeding counselling is a core component of care for small and nutritionally at-risk infants, a service that needs strengthening in community-based outpatient care. We have a common goal to achieve coordinated discharge so that at-risk infants under 6 months and their mothers have timely access to ongoing support and care. We call on you to join the MAMI Global Network's efforts to work together to reach the most vulnerable and at-risk mothers and their infants. Thank you for listening.
Thank you, Nikki. Let me just adjust the slide here. Hi again, I'm Jodine Chase, the IFE Core Group Facilitator. We've been called to step up for breastfeeding in this webinar, and we have learned so much already. This last section is about how we are called to step up during emergencies. We all know these numbers. Almost 90 million people forcibly displaced by the end of last year, and the rate of displacement due to climate change is twice the rate due to conflict. Children are 30% of the world's population, but they make up 41% of those displaced. Suboptimal breastfeeding leads to an excess of 820,000 deaths per year, while exclusive and continued breastfeeding alongside complementary feeding is the single most effective intervention to prevent deaths in children under the age of 5. So when protection actions like the 10 steps are in place, and when MAMI Care is available to support the most vulnerable infants, communities are more likely to be breastfeeding communities, and these are better prepared for emergencies. Disasters and humanitarian emergencies disrupt breastfeeding, and additional support is needed both to preserve breastfeeding and also for the food insecure, including those partially or fully dependent on infant formula. We heard earlier this year from WHO how the pervasive, misleading, and aggressive marketing from the $55 billion formula milk industry causes harm. This is especially true during emergencies, which are often exploited through floods of donations and uncontrolled distribution of breast milk substitutes and infant foods. This undermines appropriate infant and young child feeding practices, both during the emergency and beyond. So about 20 years ago, the IFE Core Group was born. It's a global collaboration of agencies and individuals, and it developed operational guidance with evidence-based actions to safeguard life-saving infant and young child feeding in emergencies. In 2010, the World Health Assembly urged member states to adopt the guidance into their own preparedness plans and emergency responses. Now, 10 years since this call to countries for action, we're releasing the first ever report to examine the progress of member states in fulfilling this commitment. The report has found that progress is being made at the policy level. And at the same time, coordination, capacity, and clear systems for tracking progress are lagging. There are gaps in functional multi-sectoral systems to support recommended infant and young child feeding practices in emergencies. This report aims to galvanize member states and the humanitarian and development community to deliver on the global IYCFE commitment. Countries are taking measures. An increased proportion of countries in NutriDash report working on programs to support appropriate IYCFE, from 62% in 2016 to 78% in 2020. Kuwait and Lebanon implemented all elements in 2016. Nigeria developed a plan in 2018 that links emergency activities to existing policies and nutrition plans. The global trend in government funding beyond staff salaries has increased over time, but it remains well below the number of countries that report work or the presence of policies, strategies, or action plans. Until 2019, no region had more than 40% of its countries reporting funding beyond staff salaries. Available data suggests significant gaps in the availability of activities that support caregivers in nourishing their infants and young children in emergencies. These gaps exist despite the evidence that these behaviors and the services supporting them are life-saving. Current global data is inadequate to assess the numbers of people needing action, to track unmet needs, and to assess the impact of the emergency and beyond. There's no formal mechanism for member states to measure their progress, and there's no requirement to do so. And there's no consensus around methodologies for analyzing data in global databases to distinguish between emergency and non-emergency contexts. Member states have primary responsibility to provide leadership, policy, funding, monitoring, and coordination for preparedness and response to emergencies. And progress has been made, and there are many gaps. Governments must take the lead, and this report offers 6 recommendations for member states. A systems approach is needed, and 6 recommendations are also offered for humanitarian and development communities, recognizing the important and synergistic contributions they make towards creating environments where caregivers can consistently nourish their infants and young children. The first recommendation for governments is to step up and ensure that national and international preparedness plans and emergency responses include adequately funded actions as outlined in the operational guidance. And the humanitarian and development community is also being asked to step up and to develop and deliver on a policy advocacy agenda to promote uptake of actions outlined in the operations guidance. In the words of Victor Aguayo, Director, Nutrition and Child Development, UNICEF, and Francesco Branca, who we heard from earlier, from the WHO, the COVID-19 pandemic has made it clear that all countries are at risk of an emergency. Now is the time to consolidate gains from the global emergencies of the past decade and to channel these gains into our routine systems and into our preparedness and response capacities. How can you step up? Please start by downloading the report, which will be shared widely in coming days. You can use it as a tool to start a conversation in your country and to hold those responsible to account. So thank you for listening to our presentations. We now have some time left for questions and answers. So note also that all the questions and answers will be shared in a document on our website in coming days after the webinar, even if your questions aren't answered right now. So Nikki, here's a question that applies to both of us. Can these resources and guidance be used in any country or any setting? Or are they specific to developing countries or to emergency settings? I'll answer for IYCFB, and the answer is yes. One good example is how Ireland will use the operational guidance to develop their own plan in a non-development setting within Ireland. Thinking about the operations guidance more broadly, it's been used in many countries, including my own country of Canada, and it's certainly relevant to strengthen support for optimal infant feeding. What about for MAMI, Nikki?
Thanks, Jodine, and the answer is the same. Yes, of course, it's appropriate for use in many settings where there are vulnerable infants, which includes both development and emergency settings. We know that support for skilled breastfeeding falls way short in Ireland and the UK, for example, including in health facilities, as we heard earlier. The reasons why infants may be at risk in these settings could include premature infants and infants with a disability. So like anywhere, the materials are designed for adaptation and contextualization, so could apply potentially to any setting. I think you're back on mute, Jodine.
I am back on mute, thank you. Another question for you, Nikki. If I want to get involved in MAMI and support these vulnerable infants and mothers in my context, what would the first thing that I need to do be?
Of course, we're hopeful that many people will get involved in the MAMI Care Pathway Package and the MAMI work in general. I would say the first thing to do would be to download the MAMI Care Pathway Package available on the Emergency Nutrition Network website. We have been sharing links to that in the chat box. And then review those resources and gather relevant stakeholders across both health and nutrition to discuss what the needs are, what the current situation is in your context, where the gaps are in service provision, and how the MAMI Care Pathway could work in your context. It may not be possible to provide or access all services outlined in the MAMI Care Pathway immediately, depending on what other services are available across different sectors. But don't let that stop you getting started. You can start off with what is available and build up as you go. Plus, joining the MAMI Global Network, which is free for all to join, and connecting with other service providers in other contexts will facilitate learning from each other and give you tips and expertise to apply the MAMI Care Pathway Package to your context. And details on how to join can be found on our website as well. And I believe there's a link in the chat to help you get directed to the right place.
All right, and so we have a little bit more time. This next question is asking about the evidence base showing that the MAMI Care Pathway actually works.
Yes, there's been a lot of work building up the evidence towards the MAMI Care Pathway and how it might work in practice. And that's both has happened already and is ongoing currently as we speak. Core contents of the MAMI Care Pathway Package are based on and are intended to help operationalize the World Health Organization guidelines for the management of infants under 6 months with severe acute malnutrition, published in 2013. The WHO guidelines are currently under extensive revision and are specifically looking at prevention and treatment of growth faltering in infants under 6 months. Recommendations are due out end of this year or early next, hopefully. The package builds on a broad range and a variety of accumulated evidence and experience and applies well-evidenced interventions like the integrated management of childhood illnesses and breastfeeding counselling to the context of at-risk infants and mothers. Significant research is underway or planned to build a direct evidence base, including a randomized controlled trial in Ethiopia, state-level research in India, and an intervention trial in South Sudan. Suggested interventions are fundamentally behavioural in nature and low risk, but with a high potential for benefits if implemented well.
And Nikki, can IYCF counselors deliver aspects of MAMI services?
Yes, definitely. Skilled IYCF counsellors are well placed to provide this type of support. As we saw in one of the slides, skilled breastfeeding counselling is central to the MAMI Care Pathway Package, and we rely on skilled counselling support to provide that service. The feeding situation of the most vulnerable infants may be particularly challenging, and counsellors should be experienced and may require some additional training as well in order to deal with their specific issues. We need to make sure that they have the resources and the time they need to deliver high quality services, which is where the MAMI Care Pathway Package can assist and support. But I'm sure many of us on the call here today have had experience of implementing support for infants and struggling with those that are not doing so well, that are more vulnerable. And so the MAMI Care Pathway aims to go some way to addressing that gap and being able to guide practitioners on how to deliver the more specialised skilled support for those most in need.
Yes, we have a few more MAMI questions. The next one is, are there guidelines on cultural competence available for healthcare workers to provide better breastfeeding support for migrant women?
The MAMI Care Pathway outlines specific resources that are available to support those most in need. my belief is that there are not specific guidelines for migrant women, but they are a cadre of women who require specialized support. So in the same way as any other mother who requires specialized support, the pathway can be adapted to support them. So, for example, there has been some work done in contexts where migrants have been part of that. There have been refugees or folks on the move, and the pathway can be adapted to support them. Of course, it's the same as any other program, and IYCF services more generally as well. There are specific challenges that migrant women face, and the Care Pathway Package would need to be adapted to facilitate support optimally to those women. But yes, it can be provided adaptation.
And certainly from an infant and young child feeding and emergencies perspective, the supports needed for migrant women and their infants are significant, and a big piece of the on the ground work that is done implementing the operations guidance addresses specifically the issues that these families face while they are in transit. I know there have been some transit guidelines developed in recent years that are specific to supporting both those who need to protect their breastfeeding and also those who are reliant on infant formula. Next question, I apologize, my screen went blank while I was answering. What are the next steps to scale up MAMI worldwide? The comment is, for sure, WHO and UNICEF inclusion of new updates in nutrition guidelines, but what about at country levels?
Yes, an excellent question. And this is really the work of the MAMI Global Network. So I encourage you to visit the website on ENN's website, the webpage on ENN's website for the MAMI Global Network to find out the latest news. And in joining the MAMI Global Network, you'll also receive regular monthly updates on progress made, research planned, webinars planned to share experiences and information and so on. And that will give you a real insight into the work of the MAMI Global Network in scaling up their support for the most vulnerable infants and their mothers. So some examples have been given through this presentation. There's some research that has been completed, for example, in Bangladesh, in Ethiopia and other contexts, and also research underway or planned in Ethiopia, India, and also South Sudan. Of course, we presented a case study from Rwanda. So there's lots of experiences to draw from. And there is also a strategy that's being implemented by the MAMI Global Network in order to facilitate further scale up of this important approach. So I encourage you to visit the MAMI Global Network webpage at the link provided in the chat and also on this slide, thank you, Jodine, to find out more information.
Oh, that's perfect, thank you. I think this seems like a really good time to wrap up the live Q&A, but just a reminder, we've been collecting your questions. There are some answers that are also down in the chat, and we will be making sure that a full list of questions and answers is available on the website, where the link is here, and it has been also provided in the chat. So I just want to take a moment to thank our long-standing donors and partners who support the MAMI Global Network and the IFE Core Group, and who have funded the development of the report discussed today. The USAID Bureau for Humanitarian Assistance, Irish Aid, and the Eleanor Crook Foundation. I'm just going to go on to the next slide briefly to let you know that we do have quite a few resources and references available at the link that has been shared in the chat. There are some orientation videos for MAMI for the Care Pathway Package that give you an overview on YouTube. And there's, as Nikki mentioned, there is information about Save the Children's MAMI experiences in Bangladesh and in Ethiopia, and you can join the MAMI Global Network. And you can also please visit the IFE Core Group website for more information about the report that we've just released or about anything else related to infant and young child feeding and emergencies and our global operations guidance. There are a couple of references for some of the information that was presented here, and that will also be available on our website. So this closes out the end of this webinar, and I want to thank once again to the Global Breastfeeding Collective for hosting us for 2 more ways that you can step up. And I will say good evening now. Well, actually, good morning, good evening. Farewell.